coordination presentation, two colleagues by Marie-Paul Julien. Introduction: nurse play a significant role in ensuring continuity of care and coordination. Care coordination is an important ingredient in ensuring safety and quality improvement. Therefore, nurses need to be mindful of care coordination all the time because it plays a significant part in ensuring the desired of outcome are achieved. Effective strategy for collaborating with patients. Tailoring patient treatment to the patient needs is called care coordination. To offer patients with a safer and more effective treatment in the main aim of care coordination, one method involves partnering with patients and their families to help them reach the desired health outcomes, while the other strategy involves partnering with the patient and the families to facilitate the achievement of the health outcomes. The first approach consists of implementing these major approaches using health information technologies. Continuation: the second strategy involves using specific care coordination approaches, including communication and sharing knowledge, assessing patient needs and goals, helping with transition of care, creation of proactive care plan, monitoring and follow-up when needed, incorporating communities resources in the plan, supporting the patient goals. Continuation: the second strategy involves using specific care coordination approaches, including communication and sharing knowledge, assessing patient needs and goals, helping with transition of care, creation of proactive care plan, monitoring and follow-up when needed, incorporating community resources into the plan, supporting the patient goals. Continuation: additionally, researchers at Johns Hopkins University have developed a direct primary care strategy that has been found to help accomplish desired health goals for patients with numerous chronic illnesses. In this model of guide care, a specially trained registered nurse is responsible for managing a care coordination plan. She does the initial assessment of the patient, works directly with the primary care providers to design the care plan, and then works with specialists to ensure that the plan is carried out and that the patient care is not interrupted. Study after study has demonstrated how guided care can reduce total health costs by 11%. According to yet another study, the guided care model has also been linked to a considerable reduction in hospital readmissions. Change management and patient-centered care. To effectively engage patients in the care coordination plan, the healthcare team must implement change management strategies when trying to convince patients to change their behavioral health care. Providers have relied on fact or logic as a tool in the past. Most of the time, the doctors and nurses tell the patient what changes they need to make. This leads to more admonitions from the provider when the patient returns for follow-up visit without having made any changes. Continuation: it's a shame for everyone involved when care coordination fails. Change management strategy for care coordination should be implemented at the time when failure is likely to occur, according to research studies, encouraging patients to take an active role in their health care rather than dictating them to results in better outcomes for everyone. Continuation, provider change management seek to understand patients and help them overcome barriers of health living than dictating to them. It's necessary for providers to change their attitudes towards care when introducing self-management support strategy. The care coordination plan must focus more on the patient needs and goals than the providers. Increasing positive outcomes have been demonstrated when patients are encouraged to come up with a creative solution to reach their goal. A positive impact on the patient experience has been shown to be achieved through care coordination. Teamwork and communication enhance patient satisfaction, according to the Joint Commission. According to the studies, effective care coordination planning is essential to the delivery of quality care, especially with the passage of Affordable Care Act and the growing importance of patient satisfaction and quality of care. Ethical decision-making and coordinated care plans. A full understanding of ethical concepts is required for nurses in order to have an impact on patient care from an ethical stance. When a nurse understands that ethical decision making is included in the care coordination process, it can help them to make matters concerning coordination care more seriously. Strategy for care coordination must adhere to the principles of autonomy and beneficence at the same time. Respecting patient autonomy is recognizing a patient's right to make decisions about his or her own health care and treatment. Continuation. In order for ethical care coordination initiative to be successful, patient participation is essential. According to the ethical rules of American Nurses Association, the nurse must also speak up in support of the right of the patient. When advocating on behalf of the patient throughout the implementation of care coordination plan, the nurse plays an important role in ensuring safety and quality care, in acting even when doing so many wrongs counter to the opinions of others. Cultural approaches are employed in ethical care coordination in order to provide the highest possible quality of care to all patients, regardless of their race or cultural background. Healthcare policy provision on outcomes and the patient experiences. Patient outcomes are significantly impacted by the Patient Protection and Affordable Care Act implementation. These policies provisions are intended to enhance patient coordination of primary care. According to research, patients will benefit from the Affordable Treatment Act provision by gaining easier access to coordinated treatment, experiences of fewer hospitalization, and experiencing enhanced coordination and continuum of care. According to the evidence-based research, countries with an effective system of care coordination have better patient outcomes. These individuals are more likely to receive preventative care, receive treatment before the deterioration of health disorder, and hence have fewer hospitalization admissions This strategy results in decreased mortality, increased lifespan, and improved self-care. Conclusion: registered nurses play an important role in coordinating and managing care for the patient from the hospital to the home. Beneficial results and experiences are obtained when patients' want and preference are taken into an account throughout the coordination of care. Nurses who coordinated treatment should understand healthcare policy and law. Patients and their families, as well as nurses, should be aware of the ethical implementation of care coordination. References as follow, see attached. Thank you.